We'll begin to review the anatomy of the pelvis by studying what is common to both the male and female pelvis. The bones, the muscles, the vessels are all common in both the female and the male. There will be some differences in the size and shape of the pelvis because the female pelvis is built for bearing children, and so the shape is a little bit different, so a little bit wider and a little bit deeper, but we won't cover those exact specifics in this class. The pelvis is generally defined as the area from the top of the iliac crest, the iliac wings here, to the bottom of the ischial tuberosities here. And so we'll study the anatomy that is contained within that area. This is a 2D rendering, and it's sometimes hard to tell what is anterior and posterior when you view an image like this. So I have created a 3D quick review. It's video only, not audio, just to show you what you can do with Netter's 3D, which is very similar to Biodigital Human that I did for the vessels earlier. And you'll be able to see how you can view the pelvis in 3D, and that makes it a little bit easier to understand the anatomy. Also, viewing this in CT rather than MR, a lot of times it's easier because the bone shows up bright white, so it's very easy to trace the anatomy. So we will review the pelvis. There are three main bones to the pelvis. They all come in pairs to a degree. The ilium, which are these large wings up here, and the ischium, which are these bones down here, and the pubis that comes across. And we're going to talk about how they articulate with the rest of the bones in the body. So the lumbar spine comes down and articulates right here at the sacral promontory with the sacrum. And the lumbar has 5 vertebrae, and the sacrum are then 5 fused vertebrae, so it looks as if it's one bone. Sometimes this first one is not fused and may look like a 6th lumbar vertebra. So it's very important that when we do a scout image to count where we are in the spine, to do MRI scans, sometimes CT scans, that we use a sagittal scout and count from the top, because that C2 is very prominent and easy to identify. Whereas if we counted from the bottom of the bony spine and counted a 6th lumbar vertebra when there wasn't one, we would be off. So that's something to take into consideration. The sacrum connects to the ilium here through the sacroiliac joint right here. Sometimes that can get inflamed and cause discomfort, as well as the sacral foramina here where the nerves and the vessels run through. Sometimes people can get some pain because of the nerves being pinched in one area or the other. The sacrum comes down and then connects with this coccyx, and you've got little vertebrae here that come down. And then when you take a look at the ilium, these are sometimes called ala. The large iliac wings are called ala. And there's many muscles that connect on the front and the back of this bone that help support the structure of the pelvis and move the muscles of the legs as well. And then also connect to muscles that go up toward the rib cage and connect to the spine as well, and we'll go over some of those muscles in this lecture. The ischium is the inferior portion of the bony pelvis. When you sit down, you actually sit on these bones called the ischial tuberosities, this little bottom part of the bone here, and sometimes people call these your sits bones. This view in Netter's is very helpful to be able to see the different portions of the pelvis and how the bones connect to one another. So this is a lateral view of the pelvis. You're seeing the ilium here in white, and the ischium in blue, and the pubis in red. And you're seeing how those 3 bones come together to form the acetabulum, which is a connection for the head of the femur. And the ilium, we often see the anterior superior iliac spine, or feel that in the front of the body. We use this for a landmark often in X-ray and CT and MR when we're positioning for the pelvis. This is that bone in the front of the body that you can feel. The pubic, you've got pubis bone, you've got the superior pubic ramus and the inferior pubic ramus, and the pubic tubercle is actually the most anterior portion of the pelvis. The pubic bone and the ischium come together to form the obturator foramen, and there are a lot of little muscles here. If you look over at the CT image, this is the obturator foramen, and you can see these small muscles here helping to connect the femur bone to the pelvis and connect the pelvis to each other, and help to support the structures and the organs that are inside the pelvis. So those are structural supports. And we said that the obturator foramen is formed by the ramus of the pubis and the ischium, and the internal and external obturator muscles here border the foramen, and then the pectineus muscle as well. And we'll go over those in a little bit more detail later. So in this image, we are down fairly low. We're down past the head of the femur, and that's why you're not seeing that rounded head of the femur that you would expect to see. You're actually seeing the ischial greater trochanter here on the side, and we'll go into that when we take a look at the femur bone. And here you're seeing the base of the ischium, and then you're seeing the symphysis pubis, the very bottom of the symphysis pubis. You don't see it as well as you would if you were just a little bit higher up. Because we scanned from the top of the iliac crest down through the base of the ischium on a pelvis, we also cover that portion of the femur that is the head of the femur that articulates with the pelvis. So we're going to go over that basic anatomy now. There's a better image of it in Netter's, but I also want to show you this radiograph. So this isn't the usual way that you see the head of the femur, but it's another nice view, and you need to be able to identify it in multiple ways. So we have the pelvis here and the acetabulum, which is that rounded area here, the socket that's formed by the ischium, the ilium, and the pubis. And the head of the femur, this round ball, articulates with that acetabulum. And then you have the greater trochanter here. This is another great landmark for looking at areas within the pelvis. You'll know where you are when you look at the greater trochanter. You're down, as we saw in the last image in the CT, you can see the muscles in the obturator foramen when you're at the greater trochanter. This is a lesser trochanter here, and it is inferior and medial to the greater trochanter, and we'll see that a little bit better on the next image. And then the neck of the femur connects the head to the shaft. So there's a neck here. It's a little bit longer than how it appears to be in this radiograph, and that's because I believe this patient has been rotated exteriorly. So they've turned the thigh bone slightly out to the side, and that's why you're not seeing the greater trochanter quite as well here. When you look at the CT image, and again we're looking at this patient, this is the anterior portion, this is the posterior portion, right and left. So we're looking from the feet up toward the head. This is the sacrum and coccyx here at the back. Rectum is just anterior to that. Uterus anterior to the rectum. And here we are at the head of the femur. And the acetabulum is this rounded portion where the head of the femur articulates with the pelvis. And we're at the level of the bladder here as well. The head of the femur is always a great landmark to look for the vessels. So you have the femoral artery and the femoral vein right here at the head of the femur. On the anterior surface of the pelvis, right along the superior pubic ramus, we've got the inguinal canal. And this is a superficial inguinal canal, and in the male pelvis, it is the area that contains the spermatic cord and courses along all the way from the pubic symphysis all the way up through the anterior superior iliac spine. So this superficial inguinal canal goes all the way up through here. And then there's a ring created by this superficial inguinal canal that allows the passage of the femoral vessels. So they're iliac vessels up here, the vein and the artery, and they come down through this superficial inguinal ring and pass posterior to that inguinal canal, and then they become the femoral vessels once they have come through that canal. And this is in there is a superficial inguinal canal in both the male and female pelvis, but this is where the spermatic cord courses through in the male pelvis. I want to take a moment to talk about the pelvic inlet and the pelvic outlet. Sometimes you will hear this mentioned. And the pelvic inlet is the very top of the pelvis here. It goes from the sacral promontory in the posterior portion of the pelvis to the anterior symphysis pubis and the superior portion of the symphysis pubis. And you could draw a line all the way around the inside portion here of this pelvic bone, and that would be the pelvic inlet. But if you just drew a straight line from the sacral promontory to the top of the symphysis pubis, and here it is down here in this lower right hand image, the sacral promontory here to the top of the symphysis pubis, that would be the pelvic inlet. And then the pelvic outlet is the bottom portion of the sacrum, and we'll look at it here for just a minute. If you look at the bottom of the coccyx and then draw a line all the way up and around the lower portion, and you can't quite see the lower portion here, but there's the posterior inferior iliac spine on the sides, and then down along the bottom of the pubic symphysis. So now we'll look at this bottom image here. The bottom of the pubic symphysis around the ischium and the ischial spine here, and then down along the bottom edge of the sacrum and up along the coccyx. If you drew a line all the way around there, that would be the pelvic outlet. And you can see it from the inferior portion of the symphysis pubis to the coccyx. And here's that line right here. That's the pelvic outlet. So I just wanted you to be aware of those terms as well. I'm going to be bouncing back and forth between the next two slides a little bit as we talk about the colon. And we've covered most of this when we covered the upper abdomen, but I just want to review it a little bit. We start with the cecum, and the ileum of the small intestine comes and attaches to the cecum of the large intestine, and just off of that is the appendix, and that's where you can get appendicitis. Sometimes that gets inflamed, and you'll get a ring enhancement with abscesses, so the outside of it enhances, but the inside of it, the actual infection portion, does not. And sometimes that can be a little bit difficult to distinguish between that and maybe enhancing colon and that sort of thing with the oral contrast. So we've got the cecum first, and then it goes into the ascending colon. And that's along the right side of the abdomen pelvis. It courses superior from the cecum and up towards the liver, and that is where you find the hepatic flexure. When you look over here at this image, you see the hepatic flexure, and it goes across the transverse colon and then over to the splenic flexure over on the left side of the patient, and then down through the descending colon and the sigmoid and rectum. The rectum is just anterior to the bony sacrum. The sigmoid is anterior to the sacrum, but it's a little bit further out, so I'm going to show you that in just a moment. It's about 12, the rectum is about 12 centimeters in length, and it starts around the third segment of the sacrum all the way down to the tip of the coccyx. So if you're as far down as the coccyx, you know that you are seeing rectum anterior to the coccyx because it's just in front. And then you have the anus and the anal canal. It's about 2.5 to 4 centimeters in length and supported by those muscles in the pelvis, the bottom muscles, the levator ani muscles. And I'm just going to go to the other image just for a moment. So once again, here's a great image, and I just wanted to show you these two images are wonderful, but this is the small intestines here, and then you've got the small intestine, the ileum that connects with the cecum. And this is a better view of it here. You've got the ileum, just a little bit of it has been cut away so that you don't see the windy small intestine here. But this ileum connects to the cecum. This is the cecum here, and then you've got the appendix that attaches to the end of that, and that can get infected. And then you've got the ascending colon here, the hepatic flexure, the transverse colon going across to the left side of the patient, the splenic flexure up by the spleen, the descending colon, the sigmoid colon, and that can be quite windy and tortuous in itself. And then you go into the rectum, and probably right about here is where you start to get into the rectum, and then it goes down toward the anus. So I just wanted to make sure that we've covered everything along that. Yes, it looks like we've covered everything. So here are some nice images of the anatomy in terms of MRI scans and also the sagittal female pelvis here. I just used one image because the course of the colon is going to be very similar in male and female pelvises. The only thing that might change it a little bit is in the female pelvis, depending on how the uterus is flexed. This is a normal anteflexion, but sometimes this uterus can be pushed back, and we're going to see that when we cover the female pelvis, so I won't go into that in detail. But the colon, the descending colon comes down and goes into the sigmoid colon, and it loops around. It can be a little bit tortuous, and then it comes in front of the sacrum. As it gets close to the sacrum, that's where it becomes the rectum. And you can see that just, maybe the first, second, or third vertebra of the sacrum, that's where you get into the rectum, and it courses right next to the sacrum and coccyx. So if you're down this low and the colon is right up against the bony anatomy, then you know that this is going to be rectum. I have labeled these. This is for the female pelvis lecture that we're going to do a little bit later on, so don't worry about these right now for this week. I just wanted you to, or for this actual lecture, I just wanted you to see this particular picture. So going from posterior to anterior, you have the sacrum and coccyx here. Just anterior to that is the rectum. And then you have the uterus in this particular patient, of course, because it's female, and then the bladder, and then the symphysis pubis on the anterior side of the patient. If you look at the images above, here we are down in the coccyx. We're fairly low down. We're down at the level of the femoral head and the femoral neck and the greater trochanter. You've got the symphysis pubis and the ischial tuberosity, so you know you're fairly low in the pelvis, almost at the bottom of it. So that with this being the coccyx, the anatomy that is just anterior to that is going to be the rectum. You wouldn't be up as high as the sigmoid colon at this point. And you can see how close the rectum is to the coccyx. If you go a little bit higher up in the patient here now, so we're not quite into the femoral heads, you don't see that rounding of the femoral heads yet. You're just coming out of the ilium. We don't have the symphysis pubis in the front, so you know you're not that low down. We're up in the sacrum, we're a little higher up, and the colon is further away from that bony anatomy. So that's the sigmoid, and as it starts to course closer and closer to the sacrum and the coccyx, then you're going to be getting into the rectum. So it's probably just making that turn here where you're coming into the rectum. Moving on to the ureters, and we've also discussed this a little bit when we were talking about the upper abdomen. Both in the male and female, the ureters course inferior from the kidneys. They pass anterior to the psoas muscle. So you can see the psoas major muscle here, and that actually extends up a little bit further behind. You can't see it behind all the vessels, but it extends further up behind, so you can see how the ureter on both sides courses anterior to the psoas muscle. And then the ureters course anterior to the iliac vessels. So you've got the iliac artery and vein here and here, and it courses anterior to that iliac artery and vein. And they will both go down and insert on the posterior and inferior portion of the bladder. And the reason why they do this is because if the ureters were actually touching on the superior portion of the bladder, and the bladder fills and then it contracts when it's emptied, and then it fills and contracts, those ureters would be moving around all over the place in the pelvis. So they go down, they insert on the inferior portion of the pelvis, so that as the bladder changes shape, it won't affect where the ureters are and how they attach to that bladder. In the male, the ureters course anterior to the common iliac vessels and posterior to the vas deferens. So they course anterior to the iliac vessels, and then the vas deferens, I'll show you in just a moment, on the posterior side of the bladder, they course posterior to that. In the female, the uterus and the vagina sit right about here, and the ureters course lateral to the uterus and vagina before they insert into the bladder. So here are some pictures of the male and female bladders in a sagittal view. So these are midline sagittal views. And this is a female bladder here on the left. And the bladder sits just inferior to the uterus. This uterus is in a normal anteflexion. And this is the trigone area of the bladder here in the posterior section. And the ureters come in here and attach on the posterior side of the bladder in the trigone area. and then the urethra comes down here. And in the female, the urethra is a little bit shorter. In the male, of course, you have a much longer urethra here on the right. Not only is there a prostatic urethra, the portion that goes through the prostate, there's also a membranous urethra that goes right in front of the Cowper's glands, and then the penile or spongy urethra that goes through here down through the penis. And we'll go over that a little bit more when we study male and female anatomy. So we've got both patients facing each other here. This is the anterior portion on both sides, the symphysis pubis, and then the posterior side here with the sacrum and coccyx in the back, rectum on the male patient here, rectum, and then prostate and seminal vesicles, bladder, and symphysis pubis. And in the female patient, sacrum and coccyx, rectum is anterior to that. Anterior to the rectum is the uterus and vagina, and then anterior to that is the bladder, and then the symphysis pubis. So here are some sagittal MRI images of a male and female pelvis. Male pelvis here on the right, female on the left. And we've talked about this a little bit already, but the female urethra is short. It's about 4 centimeters in length. So you can see the bladder here filled with contrast, and you can see a thin white line. That's the urethra coming down. It's just anterior to the vagina, so sometimes during childbirth with the trauma that occurs there, you can have some damage to the urethra. Just posterior to the vagina is the rectum. And on this particular image, you can see the trigone area of the bladder, which is, remember, where the ureters come down and connect to the bladder, is in the posterior inferior portion of the bladder. It's a trigone. On the male patient, the urethra is about 20 centimeters in length, so about 5 times that of the female. There are 3 sections to it. So there's the prostatic urethra that goes down through the prostate, and the membranous urethra, just inferior to that, in front of the Cowper's glands, and then the penile urethra, or the membranous spongy urethra. So there's just a couple more images here I wanted to show you from Netter's regarding the bladder. On the left we have the female bladder, and on the right we have the male bladder. And they've taken a slice through the bladder, but also show you everything posterior to it. So normally you would not be able to see the vagina at the same time that you see the bladder and the ureter or urethra, but you're being able to see it here in the way that they have created this image. So this is the bladder here, and the fundus of the bladder, and then the trigone area here, and this is where the ureters come into the bladder, the posterior inferior portion of the bladder called the trigone, and then the female urethra here, and then the vagina is actually posterior to that, but you're seeing it superimposed with the urethra. And then here on the male side, again you have the bladder, the fundus of the bladder, the trigone area where the ureters come in, and then you see the prostatic urethra. You see the prostate on either side of that prostatic urethra before it goes into the membranous, and then the penile or the spongy urethra. And then from the posterior side, they don't have a good posterior view of the bladder from the female side, at least not that I could find. Normally on a female, of course, you would not see the ductus deferens or the seminal vesicles or the prostate. So if you just take away these 3 pieces of anatomy on both sides, then this would be what the female bladder looks like more or less as well, and also you would not have the Cowper's glands. But the bladder, from the posterior view here, the ureters come in to the posterior inferior portion of the bladder, which is a trigone area. And then here on the male bladder, you have the ductus deferens coming in from the symphysis pubis, right along that inguinal canal, and then they wrap around laterally and inferiorly. They pass anterior to the ureter. So you have the bladder here, posterior to the bladder is a ductus deferens, and then posterior to the ductus deferens is a ureter. And then those come in medial to the seminal vesicle to form the ejaculatory duct, and the seminal vesicles are inferior to the ductus deferens. The prostate is inferior to that. And we will go over that in more detail when we study the male pelvis, but I just wanted you to see how the ureters come in and attach to the base of the bladder, and then on the male pelvis, how those ductus deferens run in between the bladder and the ureter. So it's going to be difficult to distinguish the ureters until they are filled with contrast. And once that contrast has been filtered through the kidneys, they become quite white, bright, which even whiter than the vessels that are filled with contrast. So here's a CT urogram over here, and you can see how bright that contrast is in the ureters. And then you can even see where, almost where it attaches into the bladder there on the left. And then on the right, you can see the size of a normal ureter, and then the size of a ureter that has been dilated because of something, maybe something further down the line, maybe a stone or something has caused urine to back up into that ureter and has caused it to expand. You can also see how the ureters course just anterior to the psoas muscle, and this ureter may have been pushed out of the normal alignment slightly because it is dilated and there's something going on this side of the body, but you can see where that they are anterior to the psoas muscle there. I like the muscles, and I'm going to try to rein myself in and not bore you to tears with all the muscles, but I want to cover them in a few different ways so that you're able to see how they connect the rest of the body, and give you a little information about what they do, just a little bit. So these muscles that you see here for the hip and thigh, you won't find this in the pelvis, even though when we say the pelvis, we'll see these muscles, and they are on the back side of the pelvis, but you'll see these images in netters under the hip and thigh, the lower limb. So if you're looking for them, that's where you'll find them, and of course I've put the netters plate here so that you know where to look. But you've got the gluteus maximus here, and that's the most superficial muscle, the one that you feel if you put your hands on the back of your hips. That's the one that you're actually going to feel. And then the glute medius and minimus are interior to that. So you can see the minimus muscle here, and then the medius has actually been cut so that you can see the minimus. So you've got the minimus, the medius, and the maximus, and we'll also see that in cross section so that you can see how they kind of layer one on top of the other in an axial view. And then as far as the iliopsoas, that's two muscles actually. You've got the psoas muscle coming down here on either side. Remember to label them left or right when you're working on the test. And then you've got the iliacus muscle, which is here along the anterior border of that ilium, that wing of the hip. And so the psoas and the iliacus join together to form the iliopsoas, and they go posterior to the inguinal canal. And they go through there and attach on the lesser trochanter of the femur. So in terms a little bit about their function, the gluteal muscles here will help, especially the glute maximus will help in moving your leg backwards. So if you were to extend your leg backwards, that muscle would help with that. Also in taking steps up, if you're walking up the stairs, especially if you choose to press more with your heel than with your toes, you're going to feel the back of your leg and the gluteal muscles, as well as the hamstrings we're not going to get into now, but that's what they help you do. Glute medius and minimus help you with rotation a little bit of your hip and your thigh bone. Iliopsoas will help you with extending your leg forward or flexing your torso forward. So if you're going to lean over and pick up something off the floor, this muscle will help you do that. And if you were going to lift your legs straight up in the air in front of you, the iliopsoas helps you with that. Now looking at them in cross section, and I've continued to put some of that same information here so that you can refer to it on this slide as well as the previous slide. But you see the gluteals are external to the ilium. So you've got a cross-sectional CT image here. Orient yourself by looking anterior here, and this is posterior, right and left. You've got the sacrum here in the back and the sacroiliac joint here in between the sacrum and the ilium. And this is the wing of the ilium, and posterior to that is the gluteal muscles. And you'll see them over here. You can see them. This is from E-anatomy, and you'll see glute minimus here, and glute medius, and glute maximus. So those are the three muscles. This is the most posterior, and this is internal or deep to that, and the most deep muscle is the minimus, right against the posterior wing of the ilium. And then on the anterior side of the ilium is the iliacus muscle, and then you see the psoas. So they have not yet joined up to become the iliopsoas, so we are not inferior enough to have them have joined up. We're not deep enough into the pelvis yet. And we've already gone over the obturator muscles in the lower pelvis, but we were going to see them again a little bit later in the lecture. So the iliacus along the medial surface of the ilium, and it inserts to the lesser trochanter. We saw that in the previous slide. The psoas originates in the abdomen along the lumbar spine, and then it joins the iliacus muscle to form the iliopsoas. And the iliopsoas courses deep to the inguinal canal and inserts on the lesser trochanter of the femur. And you'll see it on the lateral to the spine and anterior to the ilium into the wings. Here's another view of the gluteus muscles. So in this image again, this is the anterior of the patient, this is posterior. Here you see the ilium, and then just posterior to that, the glute minimus, medius, and maximus, as well as the rectus abdominis here in the front. And here you see the rectus abdominis here. And I know we've gone over some of these muscles in the abdomen. I just wanted to review them again quickly because you do see all of these muscles in the pelvis. The rectus abdominis is going to help you again in forward flexion. You will also use this if you're going to do a sit-up. And you've got your oblique muscles here, internal oblique and external oblique. So the internal oblique sort of runs from inferior to superior as it courses, and then the external oblique runs from superior to inferior as it crosses this way. And your obliques help you to rotate. So the rectus abdominis attaches to the symphysis pubis inferiorly, and then up near the fourth and fifth rib superiorly. It's the anterior border of the pelvic cavity and helps to support your whole torso. The glute maximus is the largest and most external of the gluteus muscles. It may not look like that here. It's just a matter of where this image was actually taken in the body. The medius is between the maximus and minimus, and the minimus is the smallest and most deep, closest to the ilium. And here are some views of the pectineal ligament and the pectineal muscle. These are harder to find in netters, and they're going to be easier when I show you on the CT and MRI images. They're much easier to visualize. Again, this is another great view of the inguinal ligament here that runs all the way from the symphysis pubis all the way up to the as-is, the anterior superior iliac spine. And then another nice view of the iliacus and the psoas as they come down, and you'll see right about at the femoral head, that's when they become the iliopsoas. So when you're looking for landmarks, look for the femoral head, and that's when you'll see just one muscle and it becomes the iliopsoas. And here are some netter's views of just the pelvic floor. So we can take a look at them and see some of the muscles around here. And once again, you'll see these muscles, but they won't be as clear as they will be on the CT image. They're just easier to visualize. This is a levator ani muscle. This is a V here. And you have the obturator internal muscle here. We don't see the obturator externus muscle as well on this image. And then the piriformis is not on this particular, oh yes it is, there it is. There's a piriformis muscle right here in the back. And this is a view of the pectineus here. And I had a hard time finding it on many of the images, so I wanted to show you in netters where you could find it. But on the axial images in CT and MRI, it'll be easier to see. And then the obturator internus and externus, you can see how the internus actually goes on the interior of the obturator foramen and then attaches to the back of the femoral head. We're looking at the back of the patient here with the sacrum. And then the internus actually connects right here on the, I'm sorry, I messed that up. The internus connects on the inside of the obturator foramen and then attaches to the femoral head. And the obturator externus is on the external side of the obturator foramen here. So you've got those two muscles that you can see there, and then the piriformis right here. Now in our axial images, a little bit easier to see those three muscles that we were talking about that are fairly important here. The obturator internus is on the inside of that obturator foramen. The obturator externus is here, and the pectineus is the muscle that's most lateral. And here they are again. The obturator internus is here on the inside of the obturator foramen, and the obturator externus is here. And then you've got the pectineus. And there's a couple of other muscles in between, but you can see that those are the three that we like to focus on. Just to go over the vessels one more time. So here we are with the aorta coming down, and it bifurcates at about L4, and it bifurcates into the common iliac artery. And then that's a very short vessel. You can see here, common iliac artery. And then it bifurcates into the internal and external iliac artery. So this is internal and this is external. And when you're looking for these on axial images, you'll notice that the iliac veins, the internal and external iliac veins, are medial to the arteries. So arteries are lateral to the veins are medial to the arteries. And the internal and external iliac, the external iliac vein and artery come down through the inguinal canal, and once they pass through the pelvis, and they become the femoral artery and vein. So if we trace this back up now, you've got the femoral vein coming up, and it becomes the external iliac vein. It joins up with the internal iliac vein here, and comes up and then becomes the common iliac vein and into the IVC. So that's a quick review of the pelvic vessels. There's a few CT images here for you to look at. Once again, the common iliac artery bifurcates at about L4. It's anterior to the vein, so the iliac artery is anterior to the vein and anterior to the sacrum. So here's the iliac arteries, and here's the iliac veins. They're anterior to the sacrum, and they're just medial to the psoas muscle. And then when you get through the pelvis and you're with at the level of the femoral artery and vein, the femoral artery again is lateral to the vein. It's also usually a little bit brighter and a little bit smaller. So those are some things to look for. And again, that femoral head is a very good landmark for looking for the femoral vein, because you know then that you're through the pelvis and you're down the level of the head of the femur, and that's when you'll be looking for the femoral vein and artery. It's inferior to the inguinal canal. And these pictures are out of e-anatomy. This is a great way to trace through and take a look at the vessels. Again, the contrast is not that great, but because they have them labeled, it makes it much easier to look at. So you have the common iliac vein branching into the internal and external iliac veins, and the iliac vein is superior to the inguinal canal before it becomes a femoral vein. So you've got the external and internal iliac veins, and up here we're a little bit higher, we're at the common iliac vein. And that's our basic pelvis anatomy review, and now we'll move on to the male and female pelvis.